Dr. Oldberg, I was wondering if perhaps you could tell us something about how you happen to choose the field of neurosurgery to enter.
Well, it just appealed to me and to my natural talents, I suppose. Neurology is the most logical of all of the medical sciences. Relies less upon intuition and more upon making things fit a pattern than almost any other thing in the field of medicine. And then I'd had a lot of surgical training on animals because I'd operated upon at least 900 dogs when I was taking my master's and doctor of philosophy degrees. So I'd had a lot of surgical training, and I liked it, and I had no trouble with it. And the analytical field of neurology appealed to me.
Had there been any particular teachers who had influenced you in your interest in the nervous system while you were in medical school?
No, not really. No, I interested myself in that.
I see. What did you take your doctorate in?
Physiology.
In what aspect?
Well, we did work on the gallbladder. I got my PhD under Andrew C. Ivy of Grabazin fame.
Yes.
Before Ivy went off the deep end on Grabazin. But he had an extremely busy department of physiology at Northwestern University, and I was an instructor there and had gotten my master's degree when Dragstead had been head of that same department before he went to the University of Chicago. So I had a very big experience in physiology, and that's where I got my training, mostly in gallbladder physiology, but a lot of other things too.
Yes. And approximately what year was it that you wrote to Dr. Cushing about taking residency?
Well, I didn't write directly to him. You applied for one of the 3 hospitals in Boston in the order of preference: Peterbent Brigham, Massachusetts General, and Boston City. And I put Peterbent Brigham first. And then I heard from the Peterbent Brigham that I was to come in the spring to be interviewed by Dr. Cushing himself, because he only had one resident at a time at that point in his career, and he personally interviewed the person and appointed him if he wanted him.
Yes.
So I went and had my interview, and he appointed me.
How did he impress you that first visit?
Well, he was a very commanding figure. He was not a tall man, but he had very finely chiseled features and a deep voice, and he was very much in charge of himself, and of course he was a great man at that time. As everybody knew, he's the father of modern brain surgery.
Was he the sort of man who listened well, or was he a restless person? I imagine he had so many things going on at the same time that...
Well, he didn't listen very well, no. He did most of the talking. If you went out to his house for Sunday lunch, which I frequently did, as did all other residents in my position over the years, and he could be very brusque, and often was. But you didn't get a chance to make many dissertations to him. Actually, the only one who did was John Fulton, and that was only because John Fulton, a physiologist who was then at Harvard and then went to Yale, was interested in medical history, and Harvey Cushing was too. So they spent lots of time talking to each other, but mere residents like myself listened. We didn't speak very much.
Do you recall any of the questions that he had asked you at that first interview?
No, I don't. I think he just sized me up.
I see. Did he generally want to find out the reasons for a person entering or wanting to enter neurosurgery?
He didn't, as I recollect. Of course, that's an awfully long time ago, but as I recollect, he didn't go very deeply into much of anything.
Yes.
He had my record, of course.
Yes.
And he knew what I had been doing and was intending to do. And he sized me up, and
Yes.
the interview was not very long.
Then he contacted you later by mail, or did he
Oh, yes,
tell you that very day?
Oh, no, I heard later. I've forgotten just how, probably by mail.
You mentioned that there were about 19 actual residents in the...
Well, there were 19 solo residents in Cushing's career. By solo, I mean one man responsible for the whole service. After my time, a lot of people wanted to get in on Cushing's last days before he retired at age 65 from Harvard. And so he would have 3 or 4 people around splitting up the service. But there were just 19 that had the whole burden, and I was one of the 19.
There were a number of doctors from overseas as well as North America who spent varying periods of time there,
Yes.
from 6 months or 3 months perhaps, a year.
Yes.
Would they actually assume responsibilities in addition
Depending upon what he wanted to give them. I think that of all of the people, and he was there during my time too for a while, Hugh Cairns from England,
Yes.
originally from Australia, but who then went to England and then was head of the surgical unit at Oxford, was over there a couple of times. When he came over when I was resident, he did not take part in the residency, but prior to that he had.
I see.
So he was possibly, because Cushing was very English-oriented, one might say, he probably had more direct training as a foreigner than most anybody else that went to Cushing's clinic. But there were several other people from other countries, however. Oljenik from Holland was there when I was there. Mostly they were just observing and seeing what Cushing did and doing laboratory work and research work and things of that kind. They weren't actually handling patients from day to day.
Now, the doctor who subsequently went to start up the department at Leahy Clinic.
Poppin.
No, the...
Horrocks?
Dr. Horrocks.
Yeah, Gil Horrocks.
Now, he had been with Dr. Cushing for many years.
Oh, yes, he did. He came up from Hopkins.
Did he do a lot of the surgery himself, or did he mainly assist Dr. Cushing, or...
The only surgery that he did himself were the occasional bones that Cushing would throw him in the form of trigeminal neuralgia, of which there were very few cases in the course of a year, 3 or 4 cases perhaps, and what used to be called chondromas in those days, which were actually herniated discs.
Yes. Do you think that the patients...
They didn't know about herniated discs at that time.
Do you believe that perhaps the patients with trigeminal neuralgia were going to Philadelphia or to Baltimore?
No, Cushing wanted the brain tumors, and he didn't want to
I see.
load himself up with anything else but that.
I see. And so he must have had a way of exercising control over the admissions then.
Oh, they all had to come through him as far as neurological surgery was concerned, certainly.
Did this include trauma during the course of training?
Almost none.
Because it was elective admissions by referral.
Yes.
Predominantly.
It was all by referral. Every Monday morning you went to Dr. Cushing's office with all of the charts of the patients who had been discharged the previous week. And he wrote to all the referring doctors at that time.
Yes.
And you stood there beside his desk to prompt him while he wrote the letters.
Out of curiosity, there's so much concern today expressed by insurance companies, the public and all, about surgeons' fees, for example. Do you have any idea at all what types of fees or he would charge?
No, he never discussed that with anyone, but he was certainly very comfortable.
Yes. I believe Sir William Osler, in an article appeared about a year ago regarding his fee schedule, would sometimes charge several $100s for a consultation.
Well, Cushing almost never went out of the hospital for a consultation elsewhere. They came to see him.
Yes.
But mostly they were pretty definitely hospital cases with brain tumors when he saw them, when they came into the hospital, and most were operated upon. There were very few cases of the kind that I saw in later life, and you probably see,
Yes.
of people who have a headache or something else, and there's some psychological reason for it and not a brain tumor.
Yes.
Cushing had very, very little of that kind of thing, because people knew that he was headquarters for brain surgery, and they were pretty sure of what they were sending to him, and he was pretty sure of it too.
Yes. Now, in surgery, I imagine then Dr. Horrocks assisted him on most all the major cases then?
Oh yes, Gil Horrocks would do the opening and the closing until in the latter days of your residency with Cushing, you were allowed to do some of that, mostly closing rather than opening.
He was still using local anesthetic quite commonly at that time.
Yes, he was. We did children under local anesthesia with cerebellar operations that lasted several hours. Of course, you must remember that anesthesia at that time, at first when I went to the Brigham Hospital, where I was 3.5 years, they had drip ether with a mask. And then they began using rectal anesthesias and things like that that you couldn't control very well. So Cushing was very partial to local anesthesia. And that's what almost all cases were operated upon with.
Would you encounter commonly or as a serious problem edema, or at least a diffuse swelling of the brain that would prevent closure or compromise closure of the wound under the local anesthetic?
No, no. Of course, that can happen with the glioblastoma. Cushing was very considerate of the brain. I mean, the brain, after all, is the soul of a person. And he didn't just chop out hunks of it in order to make room to do a closure. He'd let the flap ride on a swollen brain. And then in those days, we used to use 50% glucose solution to try to shrink the brain.
Yes.
Afterwards. But there was no sacrifice of a lot of brain just to combat swelling.
Yes. In a confused patient.
And of course he was very, very meticulous in the way he did everything. He did everything with instruments. I mean, he would no more have thought of doing what some others did in those days, putting his finger into the brain to feel around the meningioma or a glioblastoma or whatever it might be, than the man in the moon. I mean, your fingers never touched the brain.
Was that true of Dr. Halstead as well?
Yes, he was a Halstead emissary, you might say.
Yes.
You identified all the blood vessels you possibly could and tied them or clipped them, mostly clipped as far as the brain's concerned, before you cut them.
Yes.
So that it was very meticulous and slow surgery.
The McKenzie clips that
We
we
had
had to
those.
refer to. Prior to that time, did Dr. Cushing use a clip of his own modification or design?
No, when I was there, they were the McKenzie clips,
Yes.
silver clips. And then, of course, he thought it was a great step in advance when endothermy came along.
Yes,
And that came along just about the time of my residency.
I see. And then he subsequently wrote that landmark paper on the olfactory group meningioma, I believe, showing that cautery helped considerably in
Yes.
removing these.
Oh, yes.
The role of the resident, then, I believe you once mentioned that every new patient admitted had to have a complete physical examination and history on the chart the following day.
That's
and
right.
also any person with any suspicion of visual impairment had to have detailed visual field examinations by the resident as well.
No, it was part of his somewhat sadistic nature that you had to do visual fields on everybody, including people with trigeminal neuralgia. And many a time I had to, having been the first one up in the morning and the last one to bed at night, I had to take a patient down the subterranean corridors about a half a block away to do eye fields at midnight,
And
because they had to be on the chart.
wouldn't that be a little bit inconsiderate of the patient, though, at that particular time
Well,
of night, or influence the results?
You were following the orders of the boss, and I think it's inconsiderate, yes. I don't think patients nowadays would like it very much. But they were, in the first place, they were in the hands of Harvey Cushing.
Yes.
And that was something. And sometimes they'd be there for 3 weeks before he even saw them. It was my job to measure the number of diopters of choking in any patient with increased intracranial pressure and record it every day. And then when I talked to Dr. Cushing about what he was going to be doing the next day or two, I would tell him who had 6 diopters and really ought to be put in ahead of others, and who else didn't. And that had some bearing on the order in which they were operated upon. The order of admission was not the order of operation. The operation was done on those who needed it as soon as possible. And that was largely done by measuring the optic discs and number of diopters of choking and things of that kind.
Visual acuity.
That's right.
If
While acuity, of course, starts to go down, you can have lots of choking without much change in acuity for a while.
If it appeared, though, the person were on the verge of going blind, perhaps, from papilledema.
Oh, yes, sure.
Then that,
I'd tell him we'd better, I think, Dr. Cushing, that this person has such and such, I think should be done.
How often
and he would take your word for that.
How often would he operate?
Every day.
In morning and afternoon?
No, you see, he came to work at about 9 in the morning in a Pierce Arrow driven by his chauffeur that had worked for him for some time, and was not afraid of him, one of the few people who was not afraid of him. And Gil Horrocks and I, as first assistant, would be in the operating room preparing and scrubbed and opening the flap. And he'd stay in his office downstairs till maybe 10, until we sent downstairs, say the flap's up. Then he'd come up and scrub.
And then, as far as closing the wound, would that be your responsibility, Dr. Horrocks' responsibility?
Well, Gil Horrocks would do, in the first part of one's residency, he did most of it, but then he would gradually turn some of it over to you. Cushing was very, very meticulous about all of those things. And he wouldn't let any raw resident close any wounds until he'd had lots of instruction and observation.
When a particular operation were over that had required, say, 6 or 7 hours, would there then be a second operation added to the schedule, or would it be canceled?
Oh, no, we did one a day.
One a day.
I was amazed when Elliott Cutler succeeded Cushing, and Bob Zollinger, my partner, who went into the Brigham with me, not in neurology. I looked at the operating schedule, and they'd have a gallbladder and then a cerebellar operation and then a hernia or something like that, all in the same morning. But not with Cushing. He had one case, as a matter of fact, Adolph, our orderly who prepared those lists, the Cushing case was always typed in red, the rest in ordinary black type. And the one red case was the case Cushing was doing.
Would that Mr. Adolph be the gentleman who used to put a sponge in his mouth as a mask when he would be in the operating room?
Yes.
Mm-hmm. The operating days would be Monday through Friday, or would Saturday be included?
Oh yes, he'd do it.
Saturday.
He'd work on Saturday too.
In the follow-up of patients, would they generally return to him, say, several weeks or several months after an operation?
No, not very often. They would go back to the doctor that sent them.
I see.
You must realize they came from all over,
yes,
including Saudi Arabia,
yes,
and places of this
even
kind.
then.
All over the, oh yes.
Mm-hmm. I see. So there was a fairly small outpatient clinic then?
Well, the outpatient clinic was a big outpatient clinic at the Brigham Hospital, but not for neurological surgery.
Yes.
You see, they had lots of general surgery there too.
Yes. Who was in charge of neurology, or the chief neurologist?
Harvey Cushing.
Himself?
Yes. Who was in charge of ophthalmology? Harvey Cushing. We didn't have an ophthalmologist, and we didn't have a neurologist. And that's where I learned a tremendous lot about neurology. You must realize that in England, at the National Hospital, it was such a backward place, really, that the neurologist would, like Gordon Holmes, would come in and wind up by outlining with a crayon where the flap should be turned for a brain tumor operation.
Yes.
The neurosurgeon was a mechanic. He came in and turned the flap and went where the neurologist told him.
Yes.
But we made our own localizations, and we didn't have any house neurologist or ophthalmologist or anything of the kind. We did all of that ourselves.
Do you think that
And
was
that was tremendous learning experience for me.
Was that generally true throughout the United States where there were neurosurgeons?
Well, there were very few. There were just Sachs in St. Louis and Fraser in Philadelphia and Ellsberg in New York.
Yes.
And you had to go to one of those 4 places.
Yes. I noticed you didn't mention Dr. Dandy.
Well, Dandy came after Cushing at Hopkins.
Yes.
And Dandy didn't like Cushing, and Cushing didn't like Dandy.
Do you know the source of that?
What?
Do you know the source of...
Well, it was partly Dandy's nature. I got along fine with Walter Dandy, and every time he came to Chicago to a meeting, he'd always get hold of me to bring some cases in so he could have a clinic. And but Walter Dandy, if you ever watched him operate, he was very, very fast. Nothing like Cushing at all. No meticulous surgery, whatever. And he'd just put his finger into the brain and scoop out a big chunk of glioblastoma or whatever it was, and the whole thing was over in no time. He also didn't spend very much time examining the patient. I mean, if a patient came in, about that time intervertebral disc herniations were beginning to rear their heads. Why, a few questions and in the hospital, the next morning an operation. He didn't, it was not anything like as detailed. But he was a very expert surgeon, there's no
Yes.
question about it. And one of the things that he did was to invent ventriculography.
Yes.
And Cushing, because Dandy had invented it, or found that it was useful, it took Cushing a few years before he really wanted to adopt it very much because somebody else had discovered it.
Was he using the technique or using pneumoencephalography at the time you went there?
No, it was all done by Burhol's
Yes.
ventriculography.
But he had come to accept it then as an important
Oh, yes.
diagnostic
Oh, yes.
aid. Do
Well,
you-
that was something he couldn't avoid, even though Dandy had invented it.
When Dr. Dandy and Dr. Cushing had worked together, and actually Dr. Dandy was still in training at Johns Hopkins, did Dr. Cushing comment at any time to you about how they had gotten along then? at
Oh,
Johns
no,
Hopkins?
Dr. Cushing didn't talk personalities, but we all knew the background.
What was the
Dandy did all the talking that
I
he
see.
felt like doing. But the background was they were just not simpatico
I see.
at all.
I believe that Dr. Dandy had been offered a position in Boston and chose to remain at Johns Hopkins.
I don't know
I
anything
believe
about
someone
that.
had,
I don't.
mentioned
After
that
all, that
once.
would have been impossible.
Yes.
You wouldn't have Cushing and Dandy in the same hospital, for heaven's sake.
No, the results of Dr. Dandy's...
But when you see, the Brigham Hospital was sort of modeled after the original Hopkins.
Yes.
And it opened in 1913, and the first head of surgery and the head of the Department of Surgery at Harvard was Harvey Cushing, and Henry Christian was the first head of medicine.
Yes.
And those were literally the only specialties we had, except general surgery, and we had Johnny Homans and David Cheever and other surgeons who did general surgery
Yes.
to fill up the remaining beds and give the residents training. They were
throughout-
all good men, and all of them characters of a kind, but good ones.
I believe that Dr. Cushing had initially been quite reluctant to leave Johns Hopkins for Boston to accept the appointment there.
Well, I never heard of that. I mean, he was chosen to be head of the department in this blue ribbon place, Peter
Yes.
Van Brigham.
But
You see, the head of both medicine and surgery and pathology, Bert Woolback, was our pathologist. They were the heads at Harvard and the Brigham.
yes,
So it was a pretty blue ribbon place.
I think it was because of pressure put on him in Baltimore to remain
To
there,
remain, well, maybe it was.
and possibly he saw that war was coming as well.
Well,
do
the
you
war
think
did
so?
come, of course. We got into it in 1918.
And then he had been in charge of the Harvard unit in
Yes,
France.
that's right.
At the time that you were working with him, what were his main clinical interests? Were the meningioma still, or the acoustic neuroma?
No, well, acoustic neuromas, Louise Eisenhart, who had been his pathologist, collated all of his acoustic tumors and wrote that really got together the book that he published on
Yes.
acoustic tumors. No, he got very interested in the pituitary body.
Yes.
And he wrote the book on pituitary basophilism,
Yes.
which I did all of the proofreading for and made the index for.
I see.
And I think that if you wanted to point to what was really interesting him, his curiosity at the time, I would have to say pituitary body.
Do you recall what turned his interest to the pituitary at the time?
Well, he'd always been interested in it. The first time I ever heard Cushing talk, I went to Cleveland when I was still in physiology at Northwestern. And Cushing gave a talk on the circulation, the portal circulation of the pituitary body at that meeting in Cleveland, which was a meeting of, whether it was the American Physiological Society or what, I can't remember.
Yes.
So that's the first time I ever saw the man.
Do you recall his interest developing, or how it might have developed with, say, so-called Cushing ulcer? This, I understand, had been first observed with removal of a cerebellar tumor.
Well,
As I
that was
recall.
no big item.
But, did this occur fairly commonly with tumors at that time?
No,
I
that
see.
was no big item.
Mhm. And then during those years, he, I suppose, had already started preparation of the monograph on meningiomas.
Yes.
Dr. Eisenhart had also been his secretary formerly, had she not? And then
Yes.
gone to medical school.
Yes.
Primarily to be in charge of the lab eventually, or?
Yes, before Bailey went.
I
There
see.
she was.
I see. And then, did you ever have occasion to hear him remark about the need for formal programs in neurosurgery? Dr. Horsley, I'm sorry, the Johns Hopkins School had more or less wanted a person to complete 5 to 7 years of training in general surgery, and then perhaps concentrate in neurosurgery. Though at that time, when Dr. Cushing had entered, or had said he wanted to enter a specialty as neurosurgery, he was discouraged from doing so.
Well, you see, what really happened was, that's not really the case at all. When Cushing had gone to Hopkins as a resident, nobody wanted the brain tumor cases. The mortality rate was 50%. And by mortality rate, I mean people who left the hospital alive were considered not in the mortality list. Those who didn't make it to the outside were those that gave you the statistics. And Cushing, of course, lowered that almost immediately to less than 10%. And it was a tremendous advance.
While he was still regarded as a trainee in general surgery, or?
Well, yes, I mean, they just let him do a lot of that kind of thing. Probably not right at the beginning. I think Halstead was the head of surgery.
Yes.
And but Cushing moved into it pretty fast. Of course, he was a very talented person.
Yes.
With his hands and with his brain and so on.
Dr. Cushing had, I believe, often said, or has been reported to have said, that he felt that a comprehensive training in general surgery should continue to remain a prerequisite for training.
Oh yes, and I had to do that too.
How many years?
We all had to go through general surgery first.
For how long, approximately?
Well, let me see. You had a surgical house officership, and that was 16 months.
I see.
And Zollinger, who later became head of surgery at Ohio State University, was my partner. He came in. We came in 2 at a time, and we stayed 16 months. And during that time, we spent part of the time in the operating room, handing instruments, just like a nurse. And part of the time we spent if you wanted to, in research, and you spent some of the time in the lab, and the rest of the time working up patients. You were a low man on the totem pole, of course. It's a relatively small hospital. And a new pair of interns, or house officers, or surgical house officers, which we were, came in every 4 months.
It sounds
And
as though
Zollinger and I came in together, same
it's-
time.
It sounds as though a good bit of initiative was expected of the resident at that time. In other words, how much time, if any, he spent in the research labs or in animal surgery.
Well, there was
depended upon the
you
initiative.
could make some choice there, yes.
Mm.
But if you wanted a Cushing residency, you better get pretty well trained
I see.
in handling people and use of your hands and in surgical technique, because Cushing was a master of that.
Yes. How many people do you believe had spent as much time with Dr. Cushing as you in formal training under him?
19.
19 total
Yes.
for the 3.5 years.
Yes. Then there were a number of others. Some of them have made marks, like Bronson Ray.
Yes.
He was never a solo resident, but he's an extremely intelligent, very fine
Yes.
man. And he has quite a history too. I mean, he'd been to Tibet a couple of times. He was such an illustrator that he was pretty nearly as good as Max Bradel
I see.
in drawing
Yes.
surgical situations. Cushing always did something at the top of his operative note, which he dictated, and that's the only part of the history he did dictate. But he'd go back to his dressing room still with his gown and gloves and shoes on and so on, and dictate the operative note and draw a picture of what he had disclosed at the operation. But it wasn't what Bronson Ray could do. Bronson Ray was really an artist.
I see. Now, many of the doctors who came from abroad or other cities in North America for much less time, 3 months, 6
yes.
months and all.
Yeah.
Did Dr. Cushing ever express a concern about those returning and establishing a department with such limited
No.
training?
No, he didn't.
Did he ever feel that there ought to be a formal residency program as exists now, for example?
No, he never discussed that around me.
I see.
I doubt that he did. I think he was pretty much a one-man operation, and I don't think that he spent a great deal of time thinking about what other people ought to be doing.
Did he ever talk about the future development of neurosurgery in the United States or elsewhere in the world, about increasing numbers of neurosurgeons, expressing concern that in time it would dilute the experience of...
No, he didn't talk about it, but of course that's what happened. You know,
Yes.
that always happens. There's a lag. As I told you earlier, at the time I went to Boston, there were 4 places to go that were nationally known, internationally known, of which the Brigham and Cushing was at the top.
Yes.
And there weren't enough neurosurgeons. There should have been more at that time, but there weren't. That's why everybody had to go to those places. Then all of a sudden, the people swarmed in, and now there are too many neurosurgeons.
Now,
And of course, that's all complicated by lots of things that have come in since Cushing would have known anything about it, like malpractice and all of the new tests that have come in and so on. I really think that the neurosurgical contingent of surgery is overpopulated now.
yes, I think that's a commonly held feeling.
Yes.
At the time you were in Boston, you had mentioned Massachusetts General and also Boston City Hospital
Yes.
having neurosurgery. Were there neurosurgeons at each of those?
Well, you see, you didn't apply for neurosurgery.
I
You
see.
applied for a surgical house officership.
I see. Mhm.
Now, what they did there was a man at the Boston City whose name escapes me at the moment, and I can't remember about the Mass General, but you went in to learn surgery,
Yes.
and that started out with general surgery.
Mhm.
And so I didn't really know. I mean, there wouldn't have been very much competition with
Yes.
those other 2 hospitals as far as neurological surgery was concerned, with Cushing right there on the ground.
Do you recall, by any chance, who initiated the idea of the formation of the Harvey Cushing Society?
Yes, I think that Van Wagenen, who was at Rochester
Yes.
and had been a resident, and Davidoff, I can't remember, maybe one or two others. But they started the Harvey Cushing Society,
Yes.
which now has gone into a tremendous big thing.
Yes.
I don't know what it's called now, but it's not the Harvey Cushing Society anymore.
No.
But at that time it was.
The reason that the name was changed, as I understand it, was a decision among the other neurosurgical societies, as well as the Cushing Society, that it ought to serve as the spokesman for neurosurgery, organized neurosurgery. And so it was changed to the American Association of Neurological Surgeons. That first meeting of the society took place at Boston, and I believe in 1931.
I can't remember what it was, 31. I don't think it was 31. It might have been. I was there in the summer of 31
Yes.
myself. I went back and spent the whole summer with Cushing and wrote a paper on hemorrhage into gliomas.
Yes.
And I reviewed, I think, 900 and some gliomas as to those that had had gross hemorrhage into them. Because there used to be a kind of a shibboleth about hemorrhage into gliomas. Anybody with a glioblastoma suspect that took a sudden turn for the worse always was supposed to have had a hemorrhage into the tumor.
Yes.
Well, of course, that's not so most of the time.
Yes.
And but it is so in a certain percentage, and my paper outlined the percentages with various kinds of tumors. Astrocytomas, almost no hemorrhages, and some in glioblastomas, but I was trying to abolish, because of my own experience, the idea that hemorrhage into gliomas was a very common thing, and every time a patient had a setback with a glioma, it's because he had a hemorrhage.
Yes.
Not that common.
When
But I went back there and worked there that summer, and then I think the next meeting was in New Haven, when Cushing had retired or been retired,
Yes.
and Cutler had taken his place and dislodged him from his office, and was sort of anxious for him to move, because two extroverts like that couldn't really work in the same place. So Cushing had gone down to Yale, and at that time he and John Fulton were interested in the
Yes.
beginnings of the library there, and he had a tremendous lot of books, and so did John Fulton,
Yes.
and that was the origin of that library.
Now, had Dr. Cushing, by the way, met Arnold Klebs through John Fulton, or had he?
I don't know about that, but Cushing, Cushing was one of these people who knew he was intended to be a great man from childhood almost. But he had in his library shelf a diary for every single year, saying just what he'd done and where he had been and all the rest of it. And he went to Europe every year, and he got acquainted with all of the people, Horsley and Klebs and
Yes.
all of that kind of people all over, so that whoever suggested that he get in touch with Klebs, I don't know.
I see.
But Cushing knew he was a man of destiny
Yes.
when he was just a young man.
Before we leave Dr. Cushing's clinical work, what were you paid as a resident at Peter Van Brigham?
I was paid, I got room, board, and laundry only as a surgical house officer, which I was for 16 months. And then I got $500 a year, which is $41 and some cents a month, both when I was assistant resident in general surgery and when I was Cushing's resident.
And that didn't change for a good many
Didn't
years
change.
either.
Stayed right there.
I believe
The $500 might let you go to the movies once in a while.
But
Buy a necktie.
In view of your clinical responsibilities, though, while you were on the service, I don't see how it had been possible to even take the time off to go to a movie.
It wasn't. I used to get out about once every 3 weeks to go downtown to the movies and come right back. You were not allowed to stay out of the hospital overnight.
Yes. And that's,
meant resident.
and that was going to compromise the person if he chose to get married at that time, too. I imagine.
It was frowned upon to get married.
I think it was stronger than that, wasn't it? That
It was frowned
in
upon,
some
and
instances tried not to.
it militated against your chances
Yes.
of getting a residency. And in fact, the Brigham Hospital book of rules that we got when we went in said that didn't say if so unfortunate as to be married, but it said at the beginning, a quotation from Osler, that when you enter medicine, the emotions should cool. And then rule number 1 was that if married, your wife had to live outside a radius of 100 miles of the Brigham Hospital. So there was a kind of a proscription on anything as legal as marriage.
Did you feel you were about to enter a monastic order when you went there?
No, I didn't. And I didn't believe, and I still don't believe at all, in these terribly protracted residencies that they used to have.
Yes.
They're unphysiological. I mean, hanging around Hopkins or Cincinnati, places like that for 7 years in the hope that you would finally become the senior resident.
Yes.
And only one would reach that pinnacle, to me is totally unphysiological and absolutely wrong.
Wasn't that somewhat in the British tradition at that time? And
I don't know
subsequently?
whether it was or not, but it's a damn fool tradition.
Now, when some years ago a movie was made of segments from earlier movies of Dr. Cushing's ward work and tributes and things like that, it depicted him dressing the wounds of the patients. Was that generally something he did, or was it something?
Oh, yes, he did that.
He did the
Every
primary
day
dressing?
in the afternoon, you brought up the case that you thought should be done the next day,
Yes.
and any recent dressing. There'd generally be 3 beds with patients in them up in the big operating room, with a double operating room in the operating floor. And you had those patients, and Cushing himself would do those dressings, about which he was equally meticulous,
Yes.
as he was in the surgery.
Would he examine the patients himself prior to surgery?
No, not much. He would a little bit. And sometimes, I still remember one in which he didn't allow the patient try to say something or indicate he wanted to speak, and Cushing be quiet, and he was testing reflexes and all the rest of it. And finally he turned to me, he said, "Oldberg, what is the symptom this patient has?" I said, "He's aphasic." He didn't give the fellow a chance to show that he was.
Well,
And another time, after all the auditors had left, because we generally had 20 people or so watching the dressings, he couldn't do a puncture, and finally he turned to me and he said, you go ahead and do it. And I did it. I mean, I got right in and got the fluid. But
it implies a
but
tremendous confidence in the resident.
what?
It implies a tremendous confidence on his part in the resident to
Well, he
thoroughly examine.
He had
the
to
patient.
have, because if you made many bad mistakes or
Yes.
anything like that, you know, I don't know how long you'd last.
Right. But that must
I
have-
lost 25 pounds in 1 year.
The other thing that I had wondered about, I believe from that movie, he was a chain smoker, and I suppose in those days it didn't really matter very much. But he seemed
He
to
smoked
smoke.
cigarettes a lot. Chain smoking, I don't know exactly that you'd call him that. He didn't have yellow fingers or anything of that sort.
It appears that maybe it was the speed of the camera at the time that recorded his smoking, that he was smoking a good bit. And
Well, he did smoke cigarettes, but not just one right after another. And after all of you in the operating room, 6 or 7 hours, he couldn't be smoking.
sure. After the patient had been operated upon and he had dressed the wound at least once, would he continue to make rounds and see these people, or would that be
He
more or
did
less
not
the last
make rounds
contact?
very often at all.
I see.
And generally they were not complete rounds. He would just see maybe some recent people who came in that he thought he finally ought to go and be acquainted with the relatives or something
Yes.
of that sort. But to make complete rounds was something that he didn't do often.
Yes. Were you there when General Wood was a patient?
No, that was
had
just
been
before my
before.
time, when Hugh Cairns was a resident.
I see.
Later became Sir Hugh Cairns, and he was a very close friend of mine. In fact, I hear from his family all the time.
Yes, he was a very great man, from what I've been told. The
He became head of the Radcliffe Infirmary
yes,
at Oxford. I think I told you that.
he had been quite active in World War II in the armed services
yes.
in Great Britain.
Oh, Hugh was quite a fellow, but he died suddenly while his children were visiting and staying at my house in Chicago.
Of a heart attack?
No, no, I think he had leukemia,
I see.
as I recollect. But we still hear from Lady Barbara, his wife, several times a year.
Is she still living in Oxford?
No, no, she lives in Norfolk.
I see. In choosing on retirement from Harvard to go to Princeton, or rather to Yale,
He didn't choose.
He didn't.
It was chosen for him.
how was
He was a difficult guy, and they were just sort of happy when he reached age 65. And Elliot Cutler was also an extrovert of a different kind, and he didn't want any Cushings around either, so it was, I think Cushing would have liked to stay on a little while, at least, because he had all of his archives there, and
Yes.
he could have written papers and things like that. But no, so he went, it was fortuitous that John Fulton was at Yale, and was all arranged that he went there.
And he could not, or had not been offered a professor emeritus at Harvard to stay on.
Well, everybody
given the
gets a
opportunity.
professor emeritus when they retire. That's what I
Yes.
am.
But with no intention.
Doesn't mean you have any merit, you know. It just means that you're retired.
Yes. But he wasn't then really offered a chance to have an
Continue?
office and
To
keep
continue?
his archives
No,
and
he
do
was not.
research.
Well, there wasn't really any room anyway at the Brigham Hospital unless you were going to crowd out Elliot Cutler.
Yes. Had Dr. Cutler been there some years then?
Well, Cutler had originally been there in general surgery.
I see.
Then he went to Cleveland. Cushing got him his position there. Because Cushing, the whole Cushing family all came from Cleveland, you know. And he was buried in Cleveland. I went to
Yes.
the services in the cemetery
Yes.
when Cushing was buried. And Elliot Cutler then came back from Cleveland to the Brigham when he was chosen to succeed Cushing.
I see.
But then he wanted to run the show.
Was there much of an age difference between them?
Well, yes, Elliot probably was 20 years younger.
I see.
I'm not so certain of that.
Was he the main reason then that Dr. Cushing didn't remain at Peterbilt Brigham?
Yes.
I see. And Dr.
Well, he
Fulton-
and the university, too. I mean, Cushing was not an easy man to get along with for anybody. And, of course, he had to be in the center of the picture, you know. That was his nature. He had to be in the center of the picture at all times. And when you're in the faculty of a big medical school, the famous one, why, there are other people that just don't think you rate being in the center of the picture all the time. And,
When you'd be invited over to his home on Sundays,
yes.
would his demeanor change from the way he acted at the
Well,
hospital?
I'll tell you,
with
Cushing had a big streak of sadism in him. And what he did was, he did it depending upon the person with whom he was dealing and their nature, which he found out about by living with them, as it were, as his resident. He would push people to just about the point where you were ready to say, you take your goddamn thing and the hell with it, and walk out. And when he saw you were just near that point, you'd get called about 11 o'clock in the morning when you were about 3 days behind in your work that you had to do. Oldberg, come out for lunch, 1 o'clock. And so that was an order, and you went. And then when you got there, he was just so sweet, it was magnificent. I mean, he'd show you all of his old diaries and go through some of his old books with you and could be charming as the dickens. And then you'd go back for another dose back to the hospital. But he liked to have people from the hospital around. His own family would be there too, Mrs. Cushing and the girls. And I was at his house for Sunday lunch many times, not just once or twice, but many times.
What was the
But even
relationship?
then, he ran the whole thing.
What was
He
the
led
relationship
the
with his family?
conversation and did most of it. Mrs. Cushing didn't say anything. The girls didn't say anything. I didn't say anything. Dr. Cushing would stand up and carve the meat. He did all the carving himself and pass it around. And I remember one thing. We always had, for dessert, we invariably had blancmange. You know, this hard stuff, you try to cut it with a knife, all of a sudden it would fly in pieces
Yes.
over the table and so on. Well, I quit. I didn't want to expose myself by having that happen, so I generally would just leave it on the plate and not eat it. But anyway, that was an experience too. And another time, he got John Fulton and me out to the house when John Marshall Fulton out to the house, and he had John Fulton there, and Mrs. Cushing was in the other room with a lady from Baltimore who was a friend of hers. And John Fulton and Cushing wanted Marshall and me to play some overtures and symphonies by Haydn and Mozart and so on, which we did forehand. We used to do that in the old piano up in the quarters at the Brigham. So we came out. Of course, Cushing couldn't care less about a musical note. Neither did John Fulton. But they sat there, and when we were diddling around, and Mrs. Cushing was kind of tittering in the other room about it because they were making an ass of both Fulton and me. I mean, Marshall and me. And he and John Fulton talked all the time about the speed of impulses from the eye to the brain and down to the fingers, making them wiggle like this. Their conversation went on all the time we were playing while we diddled along in these Mozart overtures and so on. They were talking about the impulses that went in from the printed music and into the brain and into the eyes and into the brain and then down these nerves and making the fingers. Oh, it was a very embarrassing experience. And Mrs. Cushing thought it was so funny, I could see that she was giggling in the other room at it.
Would she
it was
generally,
really ridiculous.
Would she generally participate in these Sunday afternoon sessions with Dr. Cushing?
No. After dinner, he would take you in his library, and she didn't see her again, normally.
Do you have any idea of whether it was a close family relationship he had with his wife and children?
No, it wasn't. I mean, he went to England, usually England, every summer, and Mrs. Cushing often did too, usually did. They'd go on different boats on the same day.
Why was
and, well, it's just the way it was.
It wasn't a superstition or anything?
Oh, no. No, it had nothing to do with people not traveling in the same airplane together or things like that.
Yes.
No, it was just a amicable separation or whatever you want to call it. But even at home, Cushing was still the
autocrat.
Well, it's
in the Holmesian
the autocrat of the breakfast table.
Yes.
I'm thinking of that, but that particular autocrat was a nicer man than Harvey Cushing. Harvey Cushing was not really a warm or a very nice human being a lot of the time.
Do you know of any factors that might account for his personality traits?
No, I think the Lord made him that way. I mean, he knew he was going to be famous when he was a youth, and he determined to be, and he was.
So many of the people who trained with him or trained under him assumed the same strict discipline and all that he imparted on the residents. So there must have been many qualities about the man that influenced the trainees.
Yes, plus your own natural instincts. Now, you've been a resident of mine.
Yes.
And you know that I don't like people to smoke or chew gum on rounds.
Yes.
And I don't like people to go around with white shoes with blood spots on them in public and on the elevators and so on. And I like them to be on time, and I like them to meet me when I come to the hospital.
Yes.
But I didn't inherit that from Cushing. That's my own ego at play, I guess, or something. Anyway, that's the way the Lord made me. But when it came to the meticulousness of respect for the brain and things like that, yes, Harvey Cushing, well, you couldn't possibly be his resident for all of that time without getting an enormous respect for this meticulous kind of technique that he had. Of course, the operations were very slow. They're much faster now and just as good.
Yes.
But you knew you were in the presence of a great man. That's the only way I can say it. He was a great man.
And in spite of his personality, that was sufficient to keep most of the people who trained under him with him.
Oh, yes. Oh, yes.
Were there many people who did drop out because of the inability to work with him, or?
I don't think there were very many, no, because you would be cutting your own throat.
Yes. And what are some of the other qualities that stood out that, in a positive way, that
Well, in a
affected,
positive way, what do you mean? A favorable way?
yes, in a favorable way.
Well, he published a whole book of which I also proofread and helped him with, of the various speeches and addresses that he had given in this country and in England. And he was a man, of course, he had known Horsley, he had known all of the people, all of his predecessors that had contributed to making him what he was. And he loved to talk about it, and it was fascinating to listen to him. He was very, very good at describing these people and telling anecdotes about them. But you never were allowed to reach his level in conversation. I mean, he determined the conversation and did most of it. But you couldn't help it. You can't be around a great man without some osmosis taking place. That's
Yes.
all there is to it. And Cushing was. I don't decry his position in neurological surgery or in any way. He never won a Nobel Prize because his contribution was hundreds of little things. No
Yes.
great big thing like the discovery of insulin, let's say, or
Yes.
something like that. And so he didn't qualify for anything of that kind.
Yes.
But if you had taken the time to see what he did for the mortality of operations on the brain and things of this kind, and put together all of the facets of the things that he contributed to cut mortality rate, it was about 5% when he finally retired, from 50%. I think he deserved one too,
Yes.
on this basis. But he wouldn't have been considered for that because that's given to people who do some outstanding one big thing, you know.
Yes. Well, I think that's about all the questions. Do you have any other comments that you'd like to make?
No, I've
It's been
enjoyed
a long
talking to
interview.
you. I haven't seen you for a while,
Well,
and I'm very glad that you
I
came
very
out
much
to talk to me.
appreciate your doing this for
Well, you're
us.
very, very welcome.
Well, thank you. Yes.
Baseball team, I mean. He was a good tennis player and things of that kind, although he would get mad if he didn't win, so people let him win. And but his shoes were all cut open, you know, so there'd be no pressure on his feet, and he was restricted pretty much to just playing games like croquet.